Uterine prolapse is a condition that affects women, often later in life. It happens when the uterus, the pear-shaped organ where a baby grows, drops down from its normal position in the pelvis. This occurs when the muscles and ligaments that hold the uterus in place become weakened or stretched. Imagine a hammock that supports weight. If the hammock's fabric weakens, it can sag or even fall. This condition is not life-threatening, but it can cause discomfort and affect a woman's quality of life. Understanding uterine prolapse is the first step towards seeking help and finding the right treatment. There are different degrees of prolapse, and not all women experience severe symptoms. Many women may have mild cases and not even realize it. However, if you suspect you might have uterine prolapse, it is important to consult with a healthcare professional. They can assess your individual situation and recommend the best course of action. Uterine prolapse is classified into different grades or stages depending on the severity of the descent. These stages help doctors determine the extent of the prolapse and guide treatment decisions. Understanding these stages can also help women understand their condition better. Grade 1 is the mildest form, where the uterus has only dropped slightly. Grade 2 involves further descent, with the uterus lowering into the vagina. In Grade 3, the uterus protrudes from the vaginal opening. Lastly, Grade 4, the most severe stage, involves the complete protrusion of the uterus outside the body. The degree of prolapse does not always correlate directly with the severity of symptoms. Some women with a lower grade prolapse might experience significant discomfort, while others with a higher grade might have minimal symptoms. This is why it's crucial to consult with a healthcare professional for proper diagnosis and personalized treatment. Several factors can contribute to the weakening of the pelvic floor muscles, increasing the risk of uterine prolapse. Childbirth is a major contributing factor, especially vaginal deliveries, particularly those involving large babies or the use of forceps. The strain during labor and delivery can stretch and weaken the supporting tissues. Age is another significant factor, as the pelvic floor muscles naturally weaken with age. Menopause also plays a role, as declining estrogen levels can further weaken these muscles. Other risk factors include obesity, chronic constipation, chronic coughing, and repetitive heavy lifting. These activities put pressure on the pelvic floor and can contribute to prolapse over time. Genetics can also play a role, as some women are predisposed to weaker connective tissue. It's important to note that not all women who experience these risk factors will develop uterine prolapse. However, understanding these factors can help women make informed decisions about their health and take steps to minimize their risk. Section 4. Recognizing the symptoms. Many women with uterine prolapse experience no symptoms, especially in the early stages. As the condition progresses, symptoms may begin to appear and gradually worsen over time. One of the most common symptoms is a feeling of pressure or fullness in the pelvis, often described as a dragging sensation. Some women may feel a bulge or protrusion in the vagina, which can be felt during intercourse or while inserting a tampon. Other symptoms include difficulty with bowel movements, such as constipation or a feeling of incomplete emptying. Urinary problems such as incontinence, urgency, or frequent urination can also occur. Back pain, particularly in the lower back, is another common complaint. It's important to remember that these symptoms can be caused by other conditions as well. Therefore, it's crucial to consult with a healthcare professional for an accurate diagnosis if you experience any of these symptoms. Section 5. Diagnosis and seeking help. If you are experiencing any symptoms of uterine prolapse, it is important to seek medical advice from a healthcare professional. They will ask about your medical history, including any pregnancies and childbirth experiences. They will also inquire about your symptoms, their severity, and how they are impacting your daily life. A physical examination will be conducted to assess your pelvic floor muscles and the degree of prolapse. This typically involves a pelvic exam, similar to a Pap smear, where the doctor will visually examine the vagina and cervix. They may ask you to bear down or cough to assess the movement of the uterus. In some cases, additional tests may be recommended. These might include a bladder function test, known as urodynamics, to check for urinary problems, or imaging tests such as an ultrasound or MRI to get a clearer picture of the pelvic organs. Based on the findings, your doctor will be able to determine the severity of the prolapse and recommend the most appropriate treatment options for your individual needs. Section 6. Treatment options and prevention. The treatment for uterine prolapse depends on the severity of the condition and the individual's symptoms. For mild cases, conservative management is often the first line of treatment. This may include pelvic floor muscle exercises, also known as Kegels, to strengthen the muscles that support the uterus. Lifestyle modifications, such as weight loss, treating constipation, and avoiding heavy lifting, can also help alleviate symptoms. In some cases, a device called a pessary may be recommended. A pessary is a removable device inserted into the vagina to support the prolapsed uterus. For more severe cases or when conservative treatments are not effective, surgery may be an option. Surgery typically involves repairing or reconstructing the weakened pelvic floor muscles and ligaments to restore the uterus to its normal position. Your doctor will discuss the risks and benefits of surgery and help you determine if it is the right choice for you. Section 7. Living with uterine prolapse. While a diagnosis of uterine prolapse can be concerning, it's important to remember that it is a manageable condition. With the right treatment and lifestyle modifications, most women can experience significant improvement in their symptoms and quality of life. Early detection and treatment are crucial to prevent the condition from worsening. Don't hesitate to seek help if you are experiencing symptoms. Open communication with your healthcare provider is essential to ensure you receive the best possible care. Remember, you are not alone, and there are resources available to support you. By taking proactive steps to manage your condition, you can lead a full and active life.